groups. So there's another group of virus, what we call varicella zoster virus. Varicella, in a common language, we call it chicken pox. When you see somebody, I'm sure most of you have seen people have been affected by chicken pox. The lesions, the small wounds forms all over the body. You know, that is what we call or shingles, and it's common in children. So this varicella in children is zoster in adults. But what we know, just like the first two, it is also enveloped with a cubicoid shape, also double-stranded DNA. This varicella is transmitted primarily by respiratory droplets. So, despite the fact that it lives or it manifests through what we call a, zoster or wounds or lesions all over, spread all over the body, but mostly because of that cough or sneezing or stiffness of the nose that develops during the sneezing, those droplets are the ones easily carries the virus and therefore can easily be transmitted. That is for the case of children, that is varicella, but zoster is not transmitted through that, but it is once you acquire it, it can only be caused by what you call reactivation of the latent virus. Once you have the virus, it can start manifesting and giving signs and symptoms and also causing disease in the body, especially through what we call the respiratory tract. That's where you know um, you get it through like inhalation of those droplets. Once you've inhaled through the respiratory tract system, it can spread via the blood, you know, and move to the internal organs such as the liver, and then again manifest back in the skin underneath, causing those lesions or wounds around the body. Uh, in most cases, those who might have had opportunity to see how chickenpox looks like, which is actually a cause of varicella, um, you realize that it's more of an acute uh, disease causing acute episodes, and within, of course, a short time, it is self-limiting. It can heal by itself. But once it heals, those which are within the cells, especially the sensory ganglia, can remain latently there for quite a long time and can reoccur through reactivation to cause what we call zoster years on later, especially in older and immunocompromised individuals. So interestingly, that's to mean even as we speak, all of us you could be having this happy zoster. I mean, we can be having this varicella or the zoster virus, but it only waits for an opportunity where we are not immunologically strong or during in our old age. That's where it starts now presenting itself. How do we diagnose? We can do viruses causing no, cytopathic effect. We can check in cell culture. We can also identify it using what we call fluorescent antibody test. Yeah, so this can be done. Research shows that there is no antiretroviral therapy that is recommended for varicella or zoster in the immunocompetent patient. But in the immunocompromised patient, acyclovir can be used to prevent what we call dissemination or the spread. So, um, ideally, we are saying that you can only manage the clinical symptoms, but with the time, this virus is supposed to clear unless those which have remained latently inside you know, the cells. There is a vaccine for this varicella, and it contains live attenuated virus. So these vaccines can be administered to people who are vulnerable, like the immunocompromised patients, so that uh, so that to, 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 to protect or assist them not to really be affected or have what we call adverse signs or disease present manifestation. So when you give this what we call passive immunization with the varicella zoster immunoglobulin VZIG plus acyclovir can be used to prevent dissemination in the compromised uh, patients.